Today I am going to show you a short video as a part of the pre-course material for the West Suffolk Critical Care Ultrasound course. What we are going to show you today is the various ergonomics and nomenclature which is used to show you how to maneuver the probe, and then we'll go through the various views of transthoracic echocardiogram. So here is the probe which is usually used for transthoracic echocardiography. This is a 1 to 5 megahertz probe, and the probe consists of the head, and on the head you can see the index point. After that there's the body of the probe, and then it's also called the tail of the probe. During the workshop your faculty will use various nomenclatures on maneuvering the probe, which we will see next. Now you can see here the various maneuvers of the probe and the different nomenclature used. So first of all, angle up. Somebody may tell you this is tail down, or angle down, which can be also said as tail up. Now this is in regard to the coronal plane of the human body. The next is the tilting of the probe. Now the tilting of the probe is in relation to the probe moving sideways, either to the patient's right side or left side, or in relation to a particular body part, like tilting towards the patient's shoulder. The next is the rotation of the probe. Now the probe can be rotated, you can say clockwise or anti-clockwise motion. And the last, which many people say, is about the sliding of the probe, which is on the patient's skin. So you're sliding towards one side or sliding towards the other side. So next I will show you the 5 basic views you will be using to assess the hemodynamics and to identify cross cardiac anomalies using the transthoracic echocardiogram. In this view, the 5 views are the parasternal view, which is parasternal long axis and short axis. Then you have the apical view, which is apical 4 chamber and apical 5 chamber. And lastly is the subcostal views, and in that is 2 view. First is subcostal 4 chamber, and then the inferior vena caval view. The first view is the parasternal long axis view. To get this view, the probe is placed in the 3rd or the 4th intercostal space, just to the left of the sternum, with the index point pointing towards the patient's right shoulder. You may have to move your probe around to get the correct view. Now in this view, one should see the anterior pericardium, the right ventricle, the interventricular septum, the left ventricular outflow tract, the aortic valve, then you see the left atrium, the mitral valve, and the descending aorta below. You have to be careful that the width and the depth are optimum to get the best resolution. The second view in the parasternal views is the parasternal short axis view. To get this view from the PLAX view, you rotate the probe clockwise 90 degrees towards the patient's left shoulder. You traditionally start at the base of the heart at the level of the aortic valve. Then you have to angle the probe down towards the patient's left flank to cut through the mitral valve. Further angling will result to get you a mid-papillary view. After the mid-papillary view, if you angle further down, you will get the apex. For hemodynamic assessment, you should analyze at the mid-papillary view. Now the anatomical surface landmark for the apical 4-chamber view is the same as palpating for the apex pit. The index point of the probe should face towards the patient's left flank. Now as the patient is in left lateral position, one may have to move the probe more laterally sometimes to get the best view. Now in the apical 4-chamber view, you will see the right ventricle, the right atrium, the left ventricle and the left atrium. Along with that, also the mitral valve and the tricuspid valve. The most important thing here is that you have to make sure that the interventricular septum is straight on. The next view in the apical view is the apical 5-chamber view, where you see the left ventricular outflow tract and the aortic valve. To get this view, you angle the probe up or tail down, and you can see the 5-chamber view. The next view is the subcostal 4-chamber view. To obtain this view, firstly you place the patient in a supine position, and then you place the probe just below the xiphisternum with the index point pointing towards the patient's left flank. You may have to angle up or down to get the proper image as you are viewing the heart through the hepatic window. Occasionally, you may have to rotate slightly clockwise or anti-clockwise to get the best image. From the top you see the liver, then the right ventricle with the pericardium on the top of it, then the interventricular septum, and below that is the left ventricle. And below the right ventricle on the left hand side of the image you see the right atrium, and below the left ventricle on the right hand side of the image you see the left atrium. The next view is the subcostal vena caval view. Now vena caval view is obtained by placing the probe facing towards the patient head with the index point pointing up. You may also obtain this view by rotating the probe anti-clockwise around 90 degrees from the subcostal 4-chamber view. Now in this view you should see the inferior vena cava just beneath the liver. It is important to ensure that there is a continuity between the inferior vena cava and the right atrium, because the other vessels in the vicinity are the hepatic veins, and if you angle the probe towards the patient left flank you can see the abdominal aorta. So now to end, we have covered the 5 basic views of transthoracic echocardiogram and learned about the various ergonomics used in probe movement. Please review your course literature before attending the course. We look forward to see you in the course. Thank you.